So we move on to the quiz competition session. So I request Professor Arif Amir Nawaz Sahab to come and start the session. So I'm thankful to the chairs for being here today for this session. So any comments, any remarks from the chairs?
Excuse me. I'm Professor Dr. Sarvathan Mandokhel from BMC Quetta. So listening these free paper, I came to the conclusion that most of the authors don't know the difference between these statistical terms, incidence, prevalence, and frequency. Because incidence, and as Dr. Badr Fayaz Zubairi rightly said, that this study is done regarding the incidence and prevalence in the population. But frequency, the study about frequency is done in the hospital or from a specific state of the society or population. So first of all, you should know these statistical terms like incidence, prevalence, and frequency. Then you do the study. Thank you.
So, any remarks by the chairs, or we move on to the quiz competition?
So I'll just build on that a little bit more, that I guess in medical colleges we should have robust teaching and assessment for biostatistics, which probably is lacking, I guess. I know, but obviously you can see what's happening.
Thank you, sir. I think now we are moved to the quiz competition, and I hand over this mic to Professor Arif Amir Nawaz.
I apologize for this.
एक कमेंट ले दूं मैं?
Please go ahead.
हाँ, मैंने एक किताब लिखी है SPSS एनालिसिस फॉर डॉक्टर्स, तो वो मैं फ्री देता हूँ, किसी को चाहिए मुझे ईमेल कर दे, मैं उसे भेज दूँगा. Doing statistical analysis with SPSS for doctors.
Thank you very much. Thank you, chairs. We will have to relocate you because we're going to be having judges in your seats. Thank you very much. I apologize for the slight confusion. We are trying, we have a 12-hour day. We have to stick to time, and we cannot compromise on that because we have a lot of people lined up for talks and presenting from all over the world, so we need to be. May I request Dr. Paul Ko, Dr. Bilal Hamid, and Dr. Altaf Alam to join us as judges. Being judges, not an easy task. Can I have a presentation? So, I need my presentation. All right, folks, before we started, just a couple of things. We relocated to a bigger room. Yesterday there was some confusion about scoring, and we apologize, but we are learning in the process as we go along. And so we'll try and fix that. We're running a little behind, so today we'll have to be very prompt. Is there any team joining in today that was not there yesterday? Okay, so you know you know the rules of the game, and you know that you should have listened to the talks yesterday. So, but welcome again. This is a very exciting time for us, and as I said, one thing I totally forgot yesterday, and I apologize to Bilal for that, and actually Paul also in a way, because this quiz and this meeting, we have some excellent collaborators. This particular quiz competition is being held in collaboration with the Association of Gastroenterologists of Pakistani descent of North America. I think, Bilal, this is one of your first collaborations with an organization in Pakistan. So thank you very much for being here and encouraging our, and this is a great group of people, about 250 people maybe. So, who is helping Pakistan in a lot of different aspects. And Dr. Kaur, we just received a message from Samir Shah this morning for the PSH. So we'll be transmitting that in the evening. So Dr. Paul Kaur is the designated visiting professor from the American College of Gastroenterology. And I'm sure they picked the best of the best. So thank you very much for being here. I have asked them to be judges along with their favorite Altaf Alam. So it will be a great set of judges, jury, Supreme Court of Pakistan. So let's move on. Okay guys, so just quickly go through these things. Moderator asks questions, which is Ikram. I sort of facilitate that discussion. There is 3 elites select faculty members. Teams are 2 members each. There's 1 team with a single person. Is that right? कौन सा इकराम एक टीम है? Single member team तो कोई नहीं है. They're all 2 members. Okay. Or and then audience can participate, as we said, but I was unfortunately told that there is no award for you. तो मैंने designate किया कि 1000 रुपये मैं पास से आपको दूंगा. So whoever is the audience winner, कल कोई बड़े ज़बरदस्त कोई जवाब दे रही थी. We'll move on. Okay जी. 2 rounds. The first round sequential questions. Second round first answer. Elimination round. Now इसमें मैं 1 second रुकूंगा. This is the time to decide. Do you want elimination round or do you want कि आज और कल के स्कोर क्यूमुलेट करके हम फाइनल गेम खेलें? मैं आपसे अभी इसलिए पूछ रहा हूँ कि अभी विनर कोई नहीं है. What do you want to do? All of you want to participate tomorrow and declare a winner first, second, third according to final scores, or you want 4 teams competing? Can I have a show of hands for people who think कि all 11 or 10 teams should participate tomorrow? आप competition में जो हैं. Come on, we can change the competition. Count करो जरा, हाथ ऊपर करो ना. Let's count. So majority does want to compete tomorrow. So welcome, we'll compete tomorrow. Quetta, you have been declared winner 0 already. So Quetta, kal subah flight hai unki. So thank you very much, but we will miss you. But so inshallah, kal subah we will be right back in this room competing in the same excellent manner. Okay, guys? All right. So, so you round 1 ho gaya. Aap yaad rakho bhi baat. Remember. Right question, sequential question, 100 points. Second team gives the answer, 50 points. Third team, 25. Negative scoring. कल हमने क्या सीखा? What we learned was खामोशी बहुत बेहतर है. Staying quiet is the best virtue. So stay quiet and you will win. Right? एक जवाब दे दो बस. You will win. All right. Actually, second, so round 2 में we will 10 questions and then थोड़ा सा मैंने switch किया between first and second rounds questions की nature का. The first round you have 15 seconds to answer. The second round you have 30 seconds to answer. We give a little, they are more difficult questions. So that's slightly different there, right? Okay, and negative marking there again, but the points are double of the first round, right? Okay. The biggest challenge we had yesterday was that in the second competition round, we are not able to decide. So again, I will get your vote on this. We have 2 options. Either we have raising of hands, or we do what we did yesterday. Raising of hands, I'll have to have people sitting in the middle to see who raised hands first. You're sitting on 2 different directions. So we stick with the same plan, right? No arguments. The only thing we'll do is we will increase the gap between the questions, right? So all the messages, yeses that are coming later on will be finished, right? Everybody, my request will be, in all fairness to us, everybody log on to the PC guest network. That's the same speed for everybody. Is that agreeable? All right, let's move on. So ये हमने eliminate कर दिया है. So कल all of you are welcome back here. Okay? All right. Audience participation, we talked about it yesterday. If you know the answer, do it. You'll get 1,000 rupees. There you go. From my pocket. We'll see if I have them or not. All right, guys. Test question. Now, we don't need to test the sequential question, right? We need to test the...
Sir, audience don't have to respond before the quiz participants.
Yeah, that's true. Agreed.
That would be minus 5,000.
All right. Round 2.
Without Googling it.
Round 2, test question. This is a competition question. Get ready. We need yes from you. Once you say yes, what are they registered as, names or teams on the WhatsApp group?
Now, Dr. Zishan actually changed their numbers by institution. So can we see it clearly on the screen? I think yes.
Okay. All right, guys. Test question number 1. How many talks did Dr. Paul Go give yesterday? Who is first? Oh, क्या speed up बन गई आप लोगों की? I'm impressed. जी, Zishan, who was first? Huh? No, who was the first one? JPMC Karachi. How many teams were there?
No, Sheikh Zayed.
Huh? Sheikh Zayed. Okay, excellent. Winner. Good. 200 points. 3 talks. So, this is called abusing of a speaker. 3 talks and spread over the whole day. Dr. Paul, thank you very much though. Excellent talks. Let's have a big hand for it. All right. Ikram.
Again, it is a test question.
Test question.
So it
sorry.
is repeating pancreatic cyst on CT with mucinous gelatinous fluid from ampulla on endoscopy.
This was a test of your speed and wit. This was not a knowledge test. इसका सवाल पूछा जा चुका है. So, who is the first one? Zishan. AKU. IPMN. Good. All right. Please change.
5773 जिसके आखिर में नंबर आ रहा है, ये किसका नंबर है?
I will confirm that.
इसको चेंज करें बेटा.
So why can't, so basically there should be how many?
SIUT का शायद है. Now it's SIUT.
Okay, have you all said, Zishan, your job is very
आप before going to next question always cue me, so I would send
Okay,
a message
okay.
so
Got
that
it.
that would be a divider between the
So
fresh
this-
response and old response.
Okay, so this is the last test question. Everybody ready? Zishan ready?
Yes.
Crohn's disease with, sorry.
Crohn's disease with sharp costovertebral angle tenderness and hematuria.
All right. Who was first?
Says JPMC कराची.
और तुमने बटन दबा के रखा हुआ है? चलो.
सर
Yeah, go ahead.
क्रोन्स के नाम पे ही बोल दिया था इसने पहले.
I know it's an old question.
नहीं, जो जीशान साहब की तरफ से मैसेज आएगा क्वेश्चन से पहले एक वो क्वेश्चन नंबर के तौर पे आएगा, उसके बाद जो अपीयर होगा दैट विल बी एक्सेप्टेड. आई थिंक दैट्स फेयर फॉर एवरीवन.
You can see the JPMC coming after my message. That means that was a.
So they were not sending it before you, right?
ठीक है.
So at what point will you send a message? You'll just a question शुरू होगा?
Before asking a question, you will ask me to divide the.
Okay, got it. All right, everybody set?
अभी
जी
जीशान
ये
साहब-
results day 1 मैंने कहा था इसकी मैं इसकी controversy में Zishan, would you like to change these results? ये हमारे results जो थे.
So there was a confusion because yesterday we were doing manual as well as on
Okay.
the, so there was a confusion. Some of the participants did had relevant queries. Some have got irrelevant as well because they were in the heat of moment. They were forgetting how many wrong answers they gave.
All right. So guys, we will redo it, but this is just this was not a competitive one, right? So today, what we have done is we are going to score. Everybody once accepts that this is the score, we will move on, right, Zishan? Right.
After once the question is completed, we have got the response. I will show the result at that time of that particular question, so that everybody know they have been scored
All right.
correctly.
So this is again a test question to see if you listened to the talks yesterday or not.
The proportion of hepatocellular carcinoma (HCC) attributed to non-alcoholic fatty liver disease is highest in the country.
Zishan,
Nishtar.
Nishtar,
Yes, answer please.
we did. Number 2,
Number 2 is AKUH.
Go ahead. You,
Go ahead, please.
you will
Response.
So you have
country name.
सवाल
Country
सुना
name.
नहीं है, पहले आपने guess कर दिया.
This will cost you 100. Remember this if you do this. Okay. Anybody else?
Sir,
Go ahead.
JPMC.
Sorry, minus
You have
100.
to go to the audience, please.
Audience.
Yes.
All right, let's move on. So there was answer.
So we
Answer
had
दे दिया था. Answer मैं दे दिया था. Forget it. Okay.
minus 100 for.
No, this is a test question.
It was a test question. This
question.
was an.
Yeah.
Okay.
Yes, question, yes.
All right, folks. All set now. You have learned how not to do this, right?
Let me.
Are you ready?
Wait. Now ready.
Okay. Are you ready? No, this is a sequential question. So we are going to start with SIUT, right? Usain said?
Yes.
So we are going to go around and depending on the time, we may have to cut it short a little bit, but let's go on, guys. Okay. Round one quiz competition.
HIV plus bloody diarrhea plus all's eye inclusions on biopsy.
15 seconds.
The rectal, the clonic biopsy. CMV. The
Right answer, 100 points. Keep on
100
scoring.
points for SIUT.
Well done.
Done.
Next question is for AIMS, Hyderabad. The hepatic vein pressure gradient
Wait.
required for variceal bleeding.
Wait. I cancel this question. I said before going to next question, let me.
No, this is not competition. This is sequential. It doesn't matter.
So I don't know who have responded.
No, we don't have this is a sequence question. So
That will go points to those who did not responded.
Achha, you mean those? Okay, got it. Okay.
We can't go like that.
We'll skip this question.
Next question.
Okay, next question. So you want this for everyone because this. Okay.
Before
fine.
going to every question,
Got
I
it.
will clear the chat.
Got it.
If they know the answer, then okay, chalo. Now we can go, like, sir?
Yes. Now
Dyspepsia plus thick gastric folds plus foveolar hyperplasia, the diagnosis. AIMS.
AIMS.
Yes.
Time's up. Next is JPMC.
The many triad disease, the right answer. So
Okay.
100 points or 50 points?
No, it's 100 points.
100.
No. This is second attempt.
Second attempt.
50 points.
50 points. 50 points for JPMC, please.
Zishan, you can't say time up. He will say time over because he's keeping track of that. 15 seconds, है ना? Okay, it's 15 seconds. Okay.
So can we move to the next question, please?
Wait. Okay,
Sorry.
now. All set, next question.
Go ahead.
For BMC. Patient with cirrhosis, CT scan shows an 8 mm liver nodule on CT scan. What is the management? What will you do next? So I will elaborate a little bit. What will you do next?
No, you cannot, Ikram.
Actually, the stem was not clear.
Okay. No, we get second chance. All right. GG. Time.
So we have to go to the next team,
SIUT.
SIUT. It is already on CT. You want to go for other modalities right now? Surveillance. How? It is less than 1 centimeter. So just what will you do?
So hold on, guys. Let me clarify this. The management is either an intervention or a recommendation to rescan this person. What would you like to do? At the same time or later on? Okay, I'll give you this. Judges, should we keep this question or should we throw it out? Okay.
Who is the next team?
Vague question, we'll throw it out, but the recommendation was repeat ultrasound guide, ultrasound after
It is in the guidelines that if we have less than 1 centimeter nodule, we will go for ultrasound after 4 months.
Okay, this question has been thrown out, not counted. Okay, ready, Zishan?
Yes, so we are not scoring for this one.
No.
This is. Okay, just a moment.
Don't you wish your exams were so fair that there were judges there and they said this examiner asked the wrong question, throw it out? Kitna आसान हो जाए, right? Okay.
Okay, question number 4. Again, it is
Ready?
going to PMC.
मैसेज दिखा दें व्हाट्सएप पे प्लीज.
जी जी.
BMC? कौन है? Next one. Check that.
Isolated fundal varices in setting of chronic pancreatitis. What is the cause?
किसको पूछ रहे हो? What are you
The
asking?
next team.
Next.
Next जो
The question obsolete हो गया ना, thrown off हो
अच्छा,
गया
वो
तो
cancel कर
turn
दी.
थोड़ी
Okay.
जाएगी उसकी.
Okay, ठीक.
For the same team, BMC Quetta.
splenic vein thrombosis. Yes, the right answer.
अच्छा, एक अगेन हाउसकीपिंग. आपको पता है आपको फर्स्ट सेकंड को चांस मिलेगा, तो 2 जवाब आ जाते हैं ना किसी के, तो प्लीज बार बार डोंट कीप ऑन.
नहीं, hold on. Go again.
वी गिव 2 chances to the other teams ना. थर्ड को तो नहीं देते, वो तो ऑडियंस में चला जाता है.
No. 2 more teams after the first one. So 3 teams total. Right. So, okay.
Okay, let me score it. Give me a. It was BMC Quetta plus 100. Question number 4.
BMC strategy, one right answer and say quiet after that.
Okay.
That's how you won last time, right?
Question 5 now, and let me show you the chat. Wait for me to get ready. Okay, now.
Ready?
Ikram, you announce the team, then I have to change.
Okay, yeah. So next team is Sheikh Zayed. Immunosuppressant drug with the highest risk for developing post-liver transplant hypertension. Name the drug. No. Next team.
SIUT.
SIUT. Cyclosporin, right answer.
50 points.
50 points to
50
SIUT.
points for SIUT. 0 for Sheikh Zayed.
Tacrolimus का जवाब आगे है.
Sequential point.
Tacrolimus.
That was
And this
sequential
question was taken from the last talk, previous talk.
That was an opted
So-
question. Wait a minute. Next from
You
Nishtar.
ready, sir?
Yes, now ready.
Nishtar is the next team.
Ready, Nishtar?
Can we have the question, please, sir? Ascites plus elevated bilirubin plus hepatomegaly plus weight gain in a bone marrow transplant within previous 3 weeks. The diagnosis, please.
Next team.
5 seconds. NASH cirrhosis. No. Next team, sir.
SIUT.
Sinusoidal obstruction syndrome, SOS. It is also called veno-occlusive disease. Right answer.
Excellent, right answer.
Great. Good going, SIUT.
Judges, is that okay, acceptable, right, guys? Okay.
So, 50 points for SIUT.
Okay, let me clear the chat. Good to go.
The next team is Jinnah Hospital, Lahore.
लाहौर का इज्जत करना रखना अच्छा. आसान सवाल पूछते हैं आपको.
Gastric polyps with cystic dilatation of oxyntic gland mucosa in setting of PPI use.
Next team.
So we have to go to the next team.
SIUT again.
No, not hyperplastic polyp. Next team, please.
JPMC.
Fundic gland polyp, the right answer.
25 points.
25 points for JPMC and minus 100?
Minus 100.
Minus 100 for SIUT this time.
Okay, guys. Zishan,
इसमें
clear
opt
it.
किया था. Give me a second. Let me.
आप announce, अब next team announce कर देकर तो
Ji, the next team is JPMC.
Good to go.
Good to go. Recurrent biliary colic plus elevated MLAs, high AST during symptoms, plus dilated CBD, but no gallstones. What is this condition? No.
Next is GHL.
JHL, please.
सवाल से पहले ही कर दिया था वैसे इन्होंने पोस्ट.
Jinnah Hospital?
जिना हॉस्पिटल लाहौर.
All right, move on to the next one.
Have to the next
Negative.
team.
No, that will cause negative. Next is AKUH.
Sphincter of Oddi dysfunction.
Judges to be accepted as. You want to be more specific? We'll give you a second
Yeah.
chance. Go.
Type 1.
Excellent.
The right answer.
Nice job. All
So
right.
25 to AKU, minus 100 to JHL.
Yes, minus 100 to JHL.
Good to go.
Yes, the next team is AKU. Young person with diarrhea, iron deficiency anemia, IBS-like symptoms, and low carotene levels. The diagnosis, please. Five seconds to go. The next team,
JPMC Karachi.
JPMC. It is celiac sprue, the right answer.
Screen, please.
Let me score it. 50 to
50
JPMC.
points.
for JPMC.
Yeah. Bilal, this is interesting. When I came in, I thought this was a disease of the West. You diagnosed so much celiac. And Humarshad's data from Children's Hospital is remarkable on that, how much celiac she sees. All right, folks.
So the next team is DHQ Gujranwala.
Wait. Now good to go.
Jaundice and altered mental status at 38 weeks of pregnancy with elevated bilirubin, INR, and low serum glucose levels. The diagnosis, please.
I like the sound of WhatsApp coming in the middle. Ding, ding, people like that. Yes. Judges,
Can you be more specific? Thoda se
I think this is good now. Okay, accepted. by
we
the
can,
judges.
I think, take it as right answer. Acute
Okay.
fatty liver of pregnancy, it is
DHQ
actually.
Gujranwala.
The right answer.
That
100
is
points
right
for
answer.
DHQ Gujranwala.
100 points.
And the next team is Sims Lahore.
Wait.
Yes, screen.
Wait. Screen is coming.
वो switch over, no problem. Switch over.
Okay, we can
Ready, guys?
take next
Ready.
question. That would be from Sims.
Biggest concern in a patient developing high volume GI bleed within hours of a diagnostic liver biopsy. Next team, please.
SIUT.
SIUT. जी प्लीज बताएं.
Confusion.
जी जी बताएं.
Both
बताएं,
participants
बताएं.
are getting
सही बोल रहे हैं.
All right, number second team.
That is JPMC Karachi.
Hemobilia? Hemobilia, the right answer.
Accepted.
And it requires interventional radiology maybe, if it is huge bleed.
Okay.
That
Scoring
is
करें इस
plus
पे.
50 for SIUT.
All right, Zishan, in the interest of time, I really apologize. There was a lot of confusion at the beginning. We will go to the second round questions now, and we'll have 5 questions because we are also coming back tomorrow, inshallah. Kal we will make sure that we start on time and everything runs on time. So we have full hour for this. So we'll go to now round 2. Okay, guys? Go to round 2, which is
एक क्वेश्चन
सारे आ गए ना सबको हाँ एक एक कोई टाइम नहीं है we're late. The second round will be 5 questions, rapid shooting questions. Whoever says yes first, Zishan will tell us who is going to answer that. Remember, 200 points for the winner for the right answer, minus 100 for the second one, or plus 100, and minus 100 and plus 50 for the third one. All clear? And I'll have to jump to...
Let me further clarify. It's 200 for the right answer, minus 100 for the wrong answer. The second attempt,
Yes.
whosoever attempts...
second
would
team will get 100.
will get 100 for and 100 for the negative. Again, that would remain 100. For the third one, it would be 50 plus, but again negative would be still 100.
But negative for every answer, 100 points.
Wrong answer, minus 100.
Minus 100.
Right.
Should we...
So, Dr. Zishan, can we please have the message over there?
Yes.
Ji,
All right, folks.
are we ready?
We are ready?
Fastest finger first.
Female plus monthly abdominal cramping plus chronic subepithelial nodule during flares. No nodules between flares. The condition, the diagnosis.
JPMC.
GI endometriosis is the right answer.
Excellent. So that would give 200 plus to JPMC. And we are good to go.
Next question, sir, please. Recurrent pancreatitis plus elevated IgG4 levels plus sausage-shaped pancreas on CT scan. The diagnosis, please.
JPMC.
Autoimmune pancreatitis, right answer.
Everybody
Okay,
ready?
again 200 for JPMC. Let me go to the chat again. Clear the... Okay, good to go.
Chronic diarrhea plus sporadic rash on extensor surfaces of arms.
SIUT.
SIUT, please. Herpetiform dermatitis, right answer.
Okay.
SIUT 200 marks.
I was getting a little concerned because he was just, JPMC was just jumping onto everything. So I'm glad the system is working because now somebody else is answering.
I'm not doing any bias, excuse me please.
All right, guys. कल हमको तैयारी करा के आएंगे अब you should see tomorrow. I have all the questions and I'm from Lahore. So we will see. All right.
Are you ready for the next question, sir?
Yeah, good to go.
Recurrent effortless regurgitation without retching or vomiting.
This question was asked yesterday.
No.
It was SIUT.
Again SIUT. Rumination syndrome, the right answer. 200 points for SIUT.
Now it is close tie
So,
between JPMC and SIUT.
Zishan, do you have the scores downstairs? We'll have 2 more questions, but just give a rundown now. Can you give a score rundown now? Can you highlight the score up there? पीछे formula लगा होगा ना? Don't you have a formula down there? अगर नहीं है तो छोड़ दे, print पे कर लेंगे.
So it will take time, we don't
Okay,
have
let's leave it like that. All right.
Can
that.
yes,
Just
please,
wait a
miss.
minute. Good to go.
All right, guys, ready? Yes, कोई नहीं आया अभी तक, फिक्र ना करो.
No, we haven't put the
Medication to prevent post ERCP pancreatitis.
SIUT.
Rectal indomethacin, right answer.
Great. So SIUT one.
Last question of the day, guys.
Just a moment. No, yes, ma'am. Do it.
Yeah, sorry.
Next question.
Before I go on, is Muzammil here? We need the PC team to get this room already organized to start at 9. Sorry. Okay, guys. Ready?
Next question.
Positive rheumatoid factor plus low extremity, purpuric rash, paresthesias, HCV positive patient.
JPMC.
The right answer, cryoglobulinemia.
Excellent.
Excellent.
All right, guys.
So it is JPMC versus SIUT now. So let me give the total.
We'll give what. So here's how we're going to get the scores for today. The moment we run the last question, I have to reorganize this room because this was set up for the quiz. It's not set up for the meeting. I've just moved back to the back areas, to the seats in the back, and I'll get this room reorganized, and then we'll announce the scores. Or a couple of housekeeping announcements before that, so I'm going to inshallah. I need Kashif. Can you ask Muzammil to come in with the hotel people here so we can switch this over? I'm sorry, I'm trying to do some housekeeping here, so let's do that. And we'll keep on running. So we have
One more question?
One more question. Last question, guys. Let's
We
go.
are taking question. We have to take next. We have to set the room as well for the next. Okay, one last question. Next question.
Critically ill patient, fever, thick gallbladder wall on ultrasound but no stones plus positive Murphy sign.
JPMC.
A calculus qualified as right answer.
Well done.
Okay.
All right, guys. Since we have we have 2 more minutes. Sorry,
Sir, set up
I apologize.
चलता रहेगा.
I'll try to go to the last minute. So let's एक और सवाल पूछ लेते हैं, पूछ लेंगे हम, ठीक है?
Yes.
Okay, guys. Ready?
Dr. Zishan, please, the WhatsApp screen, please.
Okay.
अब हम सर JPMC इनका मोबाइल बंद ना करवा दें 1 मिनट के लिए.
नहीं तो बात नहीं. लाहौर को हम कल जिताएंगे. आज इनको मैं सारे सवाल पढ़ाता हूँ जाके उनको. फिक्र ना करो. All right, guys, ready?
So the last question. History of gallstones, recurrent cholecystitis plus small bowel obstruction at ileocecal valve.
JPMC.
All right. G.
JPMC?
JPMC.
Right answer, gallstone
All right,
ileus.
guys, well done. Big hand for JP.
Excellent.
Excellent. So, guys, we will, as much as we like this, और कल मुझे कह रहा था पूरे दिन हम यही ना करते रहा करें. I think as a secretary of CPSP, gastroenterology, मेरा ख्याल है I should introduce this instead of, this is more learning than anything else. For people who couldn't answer, देखो, there is a lot of dynamics to it. It's a complex system right now. Yes, sir. Yeah.
Yes.
और असद साहब अपनी जेब से देंगे वो. चलें. Okay, guys. Before I go on, I would like to hear comments from our judges. Any suggestions? Any last-minute advice for our competitors?
कौन सा फार्मूला लगा?
Paul, please.
Congratulations to all of you. You did exceptionally well, and your knowledge is broad-based. And we'll have to next year, or in the future, we'll work on making sure the questions are a little bit clearer. Just being on the American Board of Internal Medicine, writing good questions is certainly an art for us, just as knowing the answer is also an art. Congratulations to all.
Thank you. Bilal.
No, impressed by all of you, and I would just also say that, you know, it's okay to be wrong, but the main purpose is to learn. So I think I would not worry about if you're be confident, answer the question, and the knowledge is amazing. And that's what I was talking to Paul, that, you know, he will gonna see all of you when we visit different hospitals, how much talent is in Pakistan, how much eagerness for learning, and that's our goal, is that we just wanted to keep promoting it. And hopefully I'll see in a day that in the same room we will have American teams and you guys are competing together. And so inshallah.
Bilal, can I ask you to say something on behalf of APGNA also, please, because you're the incoming president of that?
Yeah, so, you know, there are more than 300 Pakistani gastroenterologists in America. So we wanted to have them on one platform. So we were able to collect, there are so many residents who are applying in GI. So the goal of APGNA is to work in Pakistan and America. There are different We have different aims, and one of the big aim is that how we can attract more residents who are from Pakistan doing residency to get them into GI. We need definitely more women and female physician in GI, not only in Pakistan, but also in America. And the second aspect is how we can promote education and learning from both ends. Because when we come here, we learn so much. This is just a small effort, but we're gonna keep promoting that. We have amazing faculty doing amazing thing in America. We just want them to be recognized also, and we're gonna bring them, each of them who are doing great in academic, to some of these meetings. And you know, we were all sitting like when you all guys are about 15, 20 years back. So you all will be very successful. Just be positive, keep learning. You have great mentors. Thank you.
Thank you, Bilal. And finally, from the teachers of teachers from your area.
Thank you, Arif. Thank you, everyone. It's an amazing feeling. I really feel very, very happy and elated when I know that my students know more than me. And today I'm going back with this feeling. And certainly, one more thing, your WhatsApping skills are certainly 1,000 times better than mine. So a very good feeling I'm taking away from here. Thank you very much.
And I can tell you कि हम में से कोई आपके मुकाबले में बैठना नहीं चाहेगा, because you probably may not have the same knowledge, but WhatsApp skills बेहतर हैं आपके. So thank you very much.
Hello. I have some comments. I think that the question should be fixed turn by turn from every team. If that team does not answer, then the question should be open to the hall.
Dr. Sharbat, this has been discussed, and this is the program format right now. And we have given both opportunities. आज हमें time की वजह से, otherwise there were 2 questions from each team followed by the competition.
Yes.
दोनों का अपना अपना charm है, and I think we have to keep both of them. And this has been discussed. But thank you for your comment. We have to move on. Thank you very much, guys. We'll see you tomorrow 7:30 sharp. And thank you very much for the judges. Let's get going, guys, and we'll get the room arranged. We'll start in about 5 minutes the first session of the day. Thank you very much.